Hi again. We're going to continue our discussion of the ALS chapter of Northern Virginia, Maryland, and DC. And Terah is going to tell us all about the services that the chapter provides.
Yes, you did say Northern Virginia. We're on all of Virginia. I personally work with folks in Northern Virginia. But our chapter runs 5 different programs. They include, and then I'm going to tell you all of them, and then I'll tell you really briefly what they do.
Okay.
We have support groups. We have an equipment loan closet program. We run a transportation grant. We support multidisciplinary clinics, which we talked about last time. And we also have an assistive technology program, which we also touched on last time. So our support groups run across our entire territory. In Northern Virginia, for example, we have 2 different support groups. We have one that's available to patients and families, and we call that traditional. It's open to anybody who wants to be there. And then there's also a caregivers only group, and that's limited to caregivers and family members. And it's just an additional space for those caregivers and family members and loved ones to have some additional support, separate from the everyday needs of somebody with ALS. We also are running a virtual support group across our territory. It's pretty new.
How's that going?
I don't personally run it myself, but I've heard great things about it. It's got a good following already. I think last month we had about 18 to 19 families join, which is great. That would be a big in-person support group, so we're really happy with it. Across the rest of our territory, support groups look a little bit different. Not every region has a caregivers group. Some of them just run a traditional group. It depends on the needs of the territory. Then we also run an equipment loan closet program. I personally pull from a loan closet that's off-site in Baltimore. And then we also have an on-site loan closet for smaller items, things like disposable items like gloves, or sometimes nutrition for folks who use a feeding tube. We have smaller things like wheelchairs occasionally here. But then our off-site equipment loan closet program houses things like Hoyer lifts, power wheelchairs, more wheelchairs.
Now, again, what does that cost a patient?
All of our chapter services are free of charge. You'll never be charged for anything that comes from us. Those things we try our best to reserve for folks who don't have the insurance coverage or have a waiting period in order to get something. For example, it takes up to, I don't even want to make a guesstimate, maybe 12 weeks to get a power chair. It's different for everybody. So if you are in need of a power wheelchair in that 12-week period, you could lean on our loan closet support to fill that need while you're waiting for your own. Our loan closets don't always have every piece of equipment, but we're always happy to look to see what we have.
Now, going back to the power wheelchair, now does Medicare cover anything for that?
Yes, they will. It is important to know, however, that Medicare will only cover the cost of a wheelchair once every 5 years. And that's also important to know because it's better, in my personal opinion, to use your benefit to get a power chair as opposed to something with the manual wheelchair that you push your wheels on.
Well, she couldn't push me, and I can't use my arm, so a power wheelchair is the only option.
It might be. Yeah.
Now, what about assistive technology?
So I'll defer to Regan for that.
Yeah. So with assistive technology, like I mentioned earlier, we do have our own loan closet program. But when in regards to getting your own communication device, like an eye gaze device, that you would go through Medicare or whatever insurance you have to get that. And just like the power wheelchair, you can only get one eye gaze device every 5 years, right?
Mm-hmm.
So how does this work? Because everybody's disease is different in its in longevity. How do you tailor make something for somebody?
By doing individual assessments with the patient. So by being able to just sit down, have a conversation like we did earlier, and figure out what's going on at that time, and kind of just trialing devices out and seeing what works and what doesn't.
And you go to people's homes, or do they come here?
Both. They can come here, or I can go out to their house.
Well, ladies, thank you so much indeed for this information, and maybe we'll see you again soon.
Yeah.
Thank you.
Thanks.